Hospitals are packed full of valuable information about patients, and one startup company wants to make it possible for doctors to use that information effectively. A new app called Medopad is designed to link up every data-making system and machine in a hospital to a central service which can deliver a patient's collated records from historical medical files to X-ray, MRI scan results just at the touch of an iPad. Well, how does it work? Will it work at all? And I suppose the other question is it safe? With me now is the Chief Executive of Medopad, who is Dr. Rich Khatib, and Charles Lowe, who is President of Telemedicine and eHealth at the Royal Society of Medicine. Welcome to you. Let's start with you, if we may. Just tell us briefly how this works.
Basically, Medopad is the simplest way whereby doctors and nurses can interact with patient data. So basically, just imagine I'm a doctor, I'm in a hospital, I'm carrying a device such as this iPad, and I'm on my hospital rounds. I don't need any more paper. Basically, the patient information just comes to me. That means I can see my patient records, X-rays on the move when I'm with the patient. I have more information. I can reduce errors and make better decisions.
Dr. Lowe, it seems so simple. One wonders why it hasn't been done before.
Well, there are a lot of challenges. The technology is catching up with enabling complex things like this to be done. One of the big problems with the NHS is they've got lots and lots.
This is the National Health Service in the UK.
National Health Service in the UK, yes, sorry, I should say.
Yeah.
Is that they've got lots and lots of different systems that were devised by different people, and they don't talk to each other. And one of the really clever things about Medopad is that it creates an infrastructure in which each of these things can be gathered together and they can be presented together on a single screen.
And it contributes to better productivity, cost savings, or is it better care?
Certainly better patient outcomes, yes, because a doctor can see everything that they need to see about a patient on a single screen. And it saves money because it's all there straight away. Someone doesn't have to go away and dig it up.
One wonders if there might be a security issue, though, here.
That's a very good question, and actually that's the question we started the business in 2011 with. We said, okay, let's see why people say that, and we worked with the different agencies to find out where problems went, basically where things went wrong, and we developed a solution in a way that we try to avoid 99% of those problems by, for example, keeping all the patient information in the hospital. That's one big issue. The other is Medopad has been certified since 2013 as a CE-approved medical device. It's FDA registered. So we went from the very beginning with our application the route of getting everything certified so that our clients, hospitals mostly at this stage, are comfortable with the solution. And since they own the data, if nothing happens to the hospital data systems, there will be no real big risk here.
Dr. Lowe, the thing about the National Health Service in the UK is that it is one huge market, which is at least all connected, I suppose. In many countries, healthcare is probably quite fragmented. It would be difficult to link it up in the same way everywhere, would it not?
Well, people tend to think of the NHS as a whale. It's a huge organisation, but actually it's lots and lots of tiny little organisations which are all interworking with each other. And you know, just because you can sell to one hospital, you can't necessarily sell to another. And in fact, in some cases, if you sell to one hospital, you won't be able to sell to the other hospital because they're just determined to do something different. So it is actually quite challenging. And I think people make a great mistake when they first come to this country, anyway, and assume that there's somewhere and someone in the NHS, and if they can just sell to that person, they can get right the way through the NHS. It's much more complicated. What
about the possibility of doctors having a look at what another doctor is doing via, I don't know whether it's via the internet or how that works, but they can do that?
You see, the biggest problem most companies are trying to solve at the moment is access to the patient information when they see the patient. But we feel that these...
Because otherwise they're carrying papers around.
Absolutely.
Yeah.
And we know statistically,
20%
of them statistically are incomplete, lost. And this costs
or they're
patients'
illegible,
life.
in my experience, too.
Illegible, but this costs people's lives. This is not a matter which can be taken lighthearted. But these new technologies allow us to communicate and collaborate. So why not also leverage that? So we have, for example, built in what we call a second opinion system, where doctors can, for example, choose to share a patient's file to get a second opinion, not in hours, but actually in seconds. You have also the possibility to use video conferencing or voice, and that increases the communication. You make better
because
use
of
the
course you have a
doctor's
camera,
time.
so you can be showing the patient.
Yes, almost every device has a camera, a microphone, it's light, it fits in your pocket, it works.
Well, how might it work for a patient better in terms of maybe diagnosis or treatment, do you think?
Well, my particular speciality is treating people at home using something called telehealth. And telehealth is monitoring people at home. Now, if you can treat and monitor people at home, so get them out of hospital as quickly as possible and then treat them at home, there's much less chance of them catching a hospital-acquired infection. They're in a much happier environment. And for people who are getting old, taking them into hospital and then taking them out again is a very destabilising experience. Which they really don't enjoy very much, and it makes their lives not very happy.
Thank you very much to you both.
And may I just mention that we just launched the...
Oh no, I can see an Apple Watch
Apple
there.
Watch.
Oh,
so
no.
the first cancer app on Apple Watch, which goes exactly down the route, helping the patient to manage their own health. I think that there's a very big future, and technology can help us there.
Thank you very much indeed.
Pleasure.